Hi everyone, Candice here from Trilogy Physiotherapy. Today we'll be talking about ankle injuries. So one of the most common injuries we see at the ankle are ligament sprains. Ligament sprains are really common in people who are involved with sports, which include a lot of direction change, landing and jumping, side to side movements. So they tend to occur when we might land and roll outwards on the ankle. This movement just puts strain through the side of the ankle and can stretch the ligaments and potentially tear them. So if you come into clinic with an ankle injury, we'd start with a really comprehensive assessment. First of all, to determine which structures around the ankle might have been impacted with the injury. And then with ligaments, we also tend to grade the severity of the injury as well. So we do this using specialized tests, which put the ligaments on stress so we can determine the extent of the damage around the joint. At this initial assessment, we would also determine whether there are potentially any fractures or anything else going on at the ankle which warrants further investigation, and we'd refer you off to get imaging as required. Early stage rehab for ankles would be the same for any injury throughout the body. So we basically want to just control the pain and swelling. So with the ankle, this often looks like popping your ankle up as much as possible to control swelling. We might also give you a compressive bandage or some tubie grip to help control the swelling around there. And icing the ankle can be quite nice for pain relief too. We would advise you to avoid any aggravating activities and potentially give you a mobility aid such as crutches to help you deload the joint if needed. And this probably would depend on the severity of the injury and how your gait is looking like as well. Once your pain is settling and the injury is kind of resolving a little, then we might be able to get in and start our early stage rehab. So with the ankle, there's three main things that we look at with rehabilitation. The first is ankle range of motion. So for walking, it's really important that we have full range through the ankle joint. And sometimes after an injury, that can be limited. So potentially swelling has impacted the amount of movement through the joint. It can be tightness in surrounding muscles, such as the calf muscles as well, or even just tightness in the structures surrounding the joint, such as the joint capsule. If you haven't been moving the joint through your normal range as much as previous, these structures can just tighten up. So as far as managing reduced range of motion at the ankle, there's different mobilization techniques we might do in clinic during the session. Otherwise, we might show you different stretches and things you can do as part of a home exercise program. The other main area that we want to look at with ankle rehabilitation would be strength. So we would look at strengthening for all the major muscles around the ankle, particularly the calf muscles, so gastrocnemius and soleus. So this could look like anything from a simple calf raise to single leg calf raises and potentially getting into higher level exercises down the track, which we'll discuss as well. The other main area that we want to look at in ankle injuries is balance. So we know that the ankle is really important as part of our balance system and provides a lot of feedback to the brain around our balance and stability. So if the joint has been injured, often that can reduce the feedback coming back up to the brain around where our body is in space. And so we often include targeted balance exercises as part of our rehab program as well. So with that, it could be as simple as balance on one leg or getting into more advanced dynamic balance exercises further down the track as well. Getting further down the track into rehab, once you're on top of your strength, range of motion and balance exercises, it really does depend on what you're hoping to get back to. So if you are wanting to get back to one of those sports which involves a lot of direction changes, jumping, landing, and potentially impact as well, we would have to make sure that we include those movements in our rehab program as well. So for instance, if you were turning to basketball, we would make sure to include some sideways, forward, and potentially backwards jumping, so plyometric movements as part of our rehab. We'd also look at dynamic balance, and we could even get into some really advanced type exercises in clinic. So jumping onto a Bosu ball, we might try to incorporate some ball skills, so throwing and catching as well, just to kind of replicate the demands that the tissues will be under in sport. And we'd also provide further advice around return to sport and what might be safe for you. So sometimes we look at, if you're doing well with your rehab in a controlled environment, we might say try half a training session and see how you go. And if that's pain-free, you're not getting any swelling or anything around the ankle, no feelings of instability, then we might be able to progress to a full training session. And from there, depending on your confidence and your symptoms, you might be able to go back to competitive play depending on how you're feeling. So that's been a bit of a summary of how we might treat an ankle injury here in clinic.